Good day everyone, we are the group 3 and for today we will be discussing about the symptoms and conditions as well as the treatments and diagnosis of the cardiovascular system. So first on the symptoms and conditions, we have the term bruit. So bruit is an abnormal sound heard in auscultation or the method of listening to our body during physical examination through the use of stethoscope. This bruit is heard during physical examination that instead of the normal heart sound which is lab-dab, ang naririnig ay nagiging sound just like whooshing or rushing noise. So this is caused by turbulent blood flow on our arteries, especially on the carotid artery, which is the artery that supplies blood and oxygen in our brain. So if this is present, there's a possibility that there's a blockage or narrowing in the blood vessels. Next, we have the cardiac tamponade. This is the accumulation of fluid around the heart. If there's an increase of fluid in our heart, this causes pressure, which can further cause ineffectivity of the heart to pump blood. And this results to pericarditis or the injury to the heart and blood vessels. Third is the ectopic beat. This is an irregular heartbeat originating from the other parts of the heart other than the SA node. This can be skipped or extra beats in our heart. Although this is harmless, we still need to lessen alcohol and caffeine intake para hindi mapadalas ang pagkakaroon ng ectopic beat. Then next we have the extrasystole. This is another heartbeat that originated from other parts of the heart other than the SA node, just like this ectopic beat. Pero dito, this can be harmless or it indicates a presence of heart condition. So this shouldn't be ignored. Additionally, this is an abnormal heartbeat that happens earlier or prematurely than expected in the heart's rhythm. So this extrasystole is beat in our heart that is not aligned on the normal heartbeat of a person. Then we have the flutter. This is an abnormal heart rhythm. It means that our heartbeat per minute is rapid but still regular contraction. We often hear this in movies. Like say for example, pag kinikilig sila, they often say, "You make my heart flutter." But take note that in real life conditions, other flutters can lead to palpitations and shortness of breath.
Hypertension is a condition lower than a normal blood pressure. So ito yung kakulangan sa blood natin, like mababa yung dugo natin. It is caused by dehydration, heart problems, or severe infection. Next is the intermittent claudication. It is the pain in muscle during exercise caused by inadequate blood supply, meaning the oxygen and the nutrients demand did not meet. It is a circulatory problem where a part of your body doesn't have enough blood flow. The lack of blood flow, known as ischemia, means the affected areas of our bodies don't have enough oxygen. If ischemia lasts for too long, that can damage the affected area and even cause the affected cells to die. The main cause of this disease is that the peripheral artery disease or the PAD. Okay, next is the mitral valve prolapse. It is the movement of the mitral valve cut into the left atrium when the ventricles contract. It is caused by the combination of our genetic factors and structural abnormalities in the connective tissues of our heart valve. Meaning, yung mga connective tissues natin sa heart, which is yung mga abnormal o yung mga hindi normal, is that sila yung nagkukos kung bakit tayo nagkakaroon ng mitral valve prolapse. Next is the occlusive vascular disease or the arteriosclerotic disease of the vessels. Usually peripheral vessels caused by thickening, hardening, and loss of elasticity in the walls of our arteries. So yung mga ganitong condition is mostly sa leg siya, but it can occur in our arms. Then, minsan sa brain din natin. By managing it, you must take vitamin B, K, C, and E. The last one is the palpitation, which is the feeling of having a fast beating, fluttering, or pounding heart. So ito, yung palpitation is a sensation of our abnormally rapid or irregular heartbeat. They are typically both or brought on by stress and anxiety, as well as in alcohol and alcohol, nicotine, and caffeine. This palpitation may in rare situation indicate a more serious cardiac problems.
Pitting edema. Pitting edema is the edema that retains in the impression of the finger pressed in the skin. So pitting edema is where you push reasonably hard on your skin and 3 to 5 seconds and it will leave an indentation. So pitting edema means there's too much fluid overload in your body. Okay, what do you mean by fluid overload? First is the heart. When the heart is not moving or working properly, it leaves a back pressure, and that back pressure leads into a pressure in the veins. The fluid and veins and the fluid will leak. When the fluid is leaked, that's what you call an edema. Second is the polyterisis nodosa, necrotizing vasculitis involving medium-sized vessels. Okay, it's an ANCA negative. Well, it's not. When we say ANCA is, we don't. Small people are just hit by this disease. And take note of this: only 5 to 10% cure cases are associated with this disease. Males are usually the one who are affected by this disease, and 40 to 60 years old are the affected by this disease. Renal disease or phenomena. It's a really small blood vessels in the top of your fingers here suddenly going to spasm, so it is exposed to cold. Take note of this, guys. It only happen on fingers and toes, your toes. Regurgitation, they discussed this in the past report. So, but regurgitation is the mitral valve is located between the upper left heart chamber in the left atrium and the lower heart chamber, left ventricle. So, the healthy mitral valve keeps your blood moving in the right direction. It allows the blood to move backwards in the atrium, and that's the regurgitation. Like it will leak a fluid, then the fluid will move backwards. Lastly, is stasis. When blood collects blood pools in the veins of the lower leg.
The next is the subacute bacterial endocarditis, or the SBE, is a term used to describe a prolonged, less severe form of bacterial infection affecting the endocardium, so the inner lining of the heart chambers and valves. So, tetralogy of Fallot is a congenital heart conditions characterized by 4 specific heart defects, which is a ventricular septal defects or VSD. So, pulmonary stenosis. Ano nga ba ang pulmonary stenosis? No? Ang pulmonary stenosis ay isa itong conditions na may pagsusuri o pagkaipit ng pulmonary valve sa ating right ventricular or sa kanang bahagi ng ating puso. So, the right ventricular hypertrophy and an overriding aorta. Aorta is a first arterya na nagdadala ng oxygenated na dugo mula sa puso patungo sa iba't ibang bahagi ng ating katawan. So, VSD. So, ano na ulit ang VSD? VSD stands for ventricular septal defects, which is a congenital heart defect involving a hole in the septum. So the third bullet is a thrombogiitis. So this is a obliterans is commonly known as Berger disease. It is a rare and inflammatory conditions that primarily affects the small and medium-sized arteries and veins in the extremities. So particularly the hands and feet, this disease is often associated with tobacco use, and its symptoms include pain, ulcer, and in severe cases, tissue death. So the fourth bullet is a vegetation refers to abnormal outgrowths or masses of tissue on heart valves. So these vegetations are typically associated with infective endocarditis, so where microorganisms such as bacteria form colonies on the heart valve surface. So the fifth one is the Wolff Parkinson. So Wolff Parkinson White syndromes or the WPW syndromes is a cardiac conditions characterized by an abnormal extra electrical pathway in a heart. So two key terms of associated with WPW syndromes are accessory pathway. So accessory pathway, so an additional electrical pathway, also called the bundle of Kent, exists in addition to the normal atrioventricular pathway. So this extra pathway can lead the rapid heartbeat. So the second one is pre-excitation, refers to the premature activations of the ventricle. So through the accessories pathway, causing an early contractions and potentially leading to tachycardia.
Other heart conditions can't be prevented anymore, but there are still some that we can prevent through changing our lifestyle in order for us to become more healthy and free on cardiovascular diseases. These include quit smoking, control other health conditions such as high blood pressure, high cholesterol, and diabetes, exercise at least 30 minutes a day on most days of the week, eat a diet that's low in salt and saturated fat, maintain a healthy weight, reduce and manage stress, and practice good hygiene. So these are some of the ways that we can do on how to prevent heart diseases. Through these, we can improve our blood circulation, decrease plaque buildup, maintain our blood pressure and cholesterol levels, reduce inflammations, manage our weight, prevent infections, and many more. So as early as possible, we should do practices that are good for our cardiovascular system and for our health in general. Next, we have the diagnosis and treatment.
Cardiac ablation, a type of surgical destroying some heart tissues to improve heart function. Some examples of disease that can apply cardiac ablation is arrhythmia. Arrhythmia is a heart problem which is bumibilis or bumabagal ang tibok ng puso. There are two types of ablation. Number one is catheter using radio frequency. This catheterization needed heat and it has a tube. Number two is cryoablation. Kabaliktaran naman ito sa catheter na gumagamit ng radio frequency because in cryoablation, it is a freeze catheterization. Most common ito because heat can cause esophageal injury. So the next one, we have the coronary angioplasty. It is invasive procedure that doctor use to unblock clogged arteries using a long, thin catheter and inserted the balloon in the catheter. Once na-inserted na ang balloon sa catheter, lolobo ito paggagamitan ng pump-controlled pressure. So the third one is the artificial pacemaker, a small battery-powered device that prevents the heart from beating too slowly. The artificial pacemaker and a cardiac ablation is almost the same. Pero, ang pinagkakaibahan nito, ablation is way better than the artificial pacemaker. Why? Because it actually treats the abnormal heart rhythm by creating scar tissues. They also have the cardiopulmonary resuscitation, or also known as CPR. It is used on people in cardiac arrest to oxygenate the blood and maintain cardiac output and to keep vital signs alive. 30 compressions followed by 2 breaths, 5 sets in 2 minutes. And did you know na may mga kanta na pwedeng isakay while doing the CPR? Isa doon is Staying Alive by the Bee Gees. Here are the steps kung paano gawin ang CPR in the patient. The placement of the hand should be like this. And i-place siya in the chest of the patient. And then put pressure sa may bandang palad, sa bandang wrist ng head. Coronary angiogram, it is actually an X-ray machine procedure which looks closely at your coronary arteries to see if they are narrowed or blocked.
Coronary angiography or cardiac catheterization is an X-ray examination of the vessels and chambers of the heart, often done to identify any narrowed or clogged coronary arteries that are preventing blood from reaching the heart muscle. Ine-examine nito ang heart para malaman if may makitid or paradong vein sa heart which is nagpre-prevent sa daloy ng dugo. Ang proseso nito is a long thin tube called the catheter will be inserted or put into the femoral artery, which is yung vein sa ating groin or sa upper thigh. It will move through the arteries until it reaches the chest and move around in all directions to record pictures of the heart and coronary arteries from multiple angles. Ang procedure na ito ay nakatutulong upang makita if may anumang abnormalities sa heart, muscle, or heart valves. Next is the coronary artery bypass graft. Coronary artery bypass graft is a procedure used for treating a narrowed or blocked coronary artery that is stopping the flow of blood. From its name, bypass. So, for example, dito is dadaan ka sana pero may nakaharang. So, ipabypass mo ito or dadaan ka sa ibang daanan. Dito naman is if the coronary artery is blocked which is causing the blood to stop flowing, ibabypass mo ito or iyong lalaktawan. Para magawa ang prosesong ito ay kumukuha muna ng blood vessels sa ibang parte ng katawan, usually mga veins sa ating arms, chest, or sa legs. Ang veins na makukuha ay gagamitin na para sa bypass surgery. This procedure can be done by opening the chest and ribs, revealing the heart. And then, ang mga blood vessels, usually ang mga arteries or veins na nakuha ay igagraft na sa may clog or coronary artery. Sa clog coronary artery, so itatahi ang dulo ng nakuhang vein sa taas ng blockage at ang isang dulo nito ay sa baba ng blockage. This creates a new route for blood to flow that bypasses the narrowed or blocked coronary arteries. Ang mga ito ay magsisilbing bagong daanan ng dugo. This surgery is dangerous because during the procedure, the heart will temporarily stop beating. Next is coronary calcium scan or heart scan. This can show the calcium deposits and blockages in the heart arteries. Ang calcium deposits kasi, this can narrow arteries. And through the help of heart scan, makikita dito if may blockages or narrowed arteries. And it is also useful for diagnosing coronary artery disease in people at moderate risk or who have undiagnosed chest pain. Next is creatine kinase MB or CKMB. This CKMB is an enzyme that occurs naturally inside muscle cells throughout the body. This is found mostly in the heart but small amounts found in the skeletal muscles. Pine-perform ang CKMB test para ma-detect if there is any kind of injury sa heart. This is useful for diagnosing heart attacks. Higher level of CKMB may mean that you have had a heart attack or have other heart problems.
CT angiography is a medical procedure used to obtain image of blood vessels in the body using CT scanner. It is performed to closely examine the blood flows in the various parts of the body, particularly in the arteries. Ang CTA ay maaaring gamitin para sa pagsusuri ng cardiovascular condition tulad ng atherosclerosis, aneurysm at iba pang mga vascular issue. Next, defibrillation is an emergency procedure used to restore a normal heart rhythm by administering an electric shock to the heart. The electric shock from defibrillation aims to reset the abnormal heart rhythm, allowing for the effective blood pumping. Next, echocardiography. Echocardiography is a medical examination that uses ultrasound to obtain image of the heart. It is a non-invasive diagnostic method that provides detailed information about the structure and function of the heart. Sa pamamagitan ng echocardiography, maaaring masuri ang sukat at galaw ng bahagi ng puso, ang pagpump nito at ang maging daloy ng dugo. Karaniwan itong ginagamit para sa pagsusuri at pagsusuri ng mga cardiac condition tulad ng heart valve problems, heart failure at iba pang cardiac abnormalities. Next, the lipoprotein. Lipoprotein is a molecular structure composed of lipids and proteins. Its primary function is to transport fats and cholesterol throughout the body. There are two main types of lipoproteins. Ito ay ang low-density at high-density lipoproteins. Ang low-density lipoproteins ay kilala bilang bad cholesterol at ang high-density naman ay good cholesterol. Monitoring the levels of LDL and HDL cholesterol along with the total cholesterol ay mahalaga sa pagsusuri ng cardiovascular health at pagsugpo ng panganib ng mga sakit sa puso at ugat.
Percutaneous transluminal coronary angioplasty or the PTCA. It is also called percutaneous coronary intervention or the PCI. It is a minimally invasive procedure to open, block, or stenose coronary artery, allowing unobstructed blood flow to the myocardium. Paano nga ba isinasagawa ang coronary angioplasty? Isinasagawa ang coronary angioplasty kapag ang isang tao ay may coronary artery disease. It may be used to treat blockage in coronary artery during or after a heart attack. Ang pag-block ng one or more arteries ay maglilid sa mahina o mahirap na pag-function ng heart or tinatawag nating heart failure. Narrowings that reduce blood flow and cause persistent chest pain or angina na hindi nakokontrol ng anumang medicine. Next is the stent. Ang stent naman, isa siyang small mesh tube typically used to hold open passage in body such as weak or narrowed arteries. Kinikip niya yung artery natin maging open para payagan yung blood natin na mag-flow ng better. Nilalagay ang stent after ng angioplasty na nagpupush ng plaque sa loob ng artery. Stent is permanent and keep our artery from getting narrowed again. May disadvantage ang stent. Ang disadvantage ng paglalagay ng stent ay may possibility na ang mga blood cells natin ay maging sticky at magkukumpol na nagpo-form ng small mass o clot. Pag nag-form na ng blood clot, pwede niya nang i-block ang pag-flow ng ating blood through our artery and nagkukos ito ng heart failure or it may also lead us into death. Next naman ang stress test. Ang stress test naman, it shows how the heart works during the physical activities. Meron tayong tatlong types ng stress test. First, the electrocardiogram stress test. It uses small adhesive electrode patches that are placed on chest and connected to ECG recording device to measure heart function during exercise. Ang pangalawa naman, echocardiogram test. This test is often used to check for leaky heart valves. Nakakatulong ito na mag-diagnose ang valve disorder katulad ng heart valve regurgitation and valve stenosis. In addition, ang heart valve regurgitation, ito yung pag-leak ng valve na hindi nagko-close all the way. At ang valve stenosis naman ay isang uri ng disease sa ating puso na nagpapasikip ng valve between the heart's main pumping chamber and the body. Pangatlo is the nuclear medicine test. Ang nuclear medicine test naman, it uses small amounts of radiation to create pictures of tissues, bones, and organs inside the body. Nakakatulong ito na mag-diagnose at matreat ang mga cancer at other illnesses. Last but not the least, the troponin. Ang troponin, isa siyang protein na mahahanap sa cells ng ating heart muscles kapag high troponin ka naman ay may sign na yun na may heart attack ka at nag-i-increase ang troponin level mo within 6 hours.